You state here that your main concern in late January, February 2020 was that your situational awareness advice was not always welcome. You say that this led to a distancing for a period from offering direct advice, and you add that it was never clear which parties were most offended and why, a situation you say you encountered when professional information was presented in good faith to inform the public. And you also say there was general confusion and increasing concern as to who was in charge in government and why delays were occurring in getting, for example, key guidance documents out to the public. Mm-hmm. It's our fault, I'm sure, but that's all quite vague. Can you put some detail onto exactly what these concerns that you had in this period were?
Well, they encompass a number of issues which were concerning to me. The first was what I'm relating to here in terms of the distancing, and this is put on paper really to explain that there was a distance between the end of January and quite a bit of February, actually, between myself and ministers, particularly the Secretary of State.
Just pause there for a moment. Yeah. Which Secretary of State?
The Secretary of State for Health. And it followed a media interview I had done at the end of January where I said straight that there could well be cases in the country, which of course there were about 10 days later, and that we were unclear about, but were prepared to consider that asymptomatic infection could occur, very unclear about transmission at that point, and that it would take possibly 6 months for a vaccine to be developed. I was rather, I think, optimistic about that. This does not go down well, I'm afraid. It may well have been my presentation or the way I did that interview or the set of interviews, but I felt it was the truth. I was telling the truth. The way that was handled was that I was advised not to do any further media, and that the Secretary of State would need to clear all media, which of course we agreed to, but also that it was probably best if I just kept a distance for a while until things settled down, which I did.
You describe the press interviews on a particular day. Did you meet the Secretary of State on that day, or were you simply told that he was not happy with what you'd done?
No, I did meet the Secretary of State on that day, and he did make his displeasure clear.
In what way?
He asked me not to patronise him.
From what you've said, you weren't trying to do anything that would either let the Secretary of State down or indeed anything other than promote the objectives of Public Health England and the Department for Health.
Absolutely.
But I think you've said that you were told either by Mr. Hancock or others that you shouldn't have any direct contact with him for a period of time after this incident.
Not quite. I was advised by colleagues in the civil service that this would be the best way to calm things down. And I understood that and I complied.
But this was at a time when, you tell us, but perhaps you would have expected to have quite frequent contact with the Secretary of State, given the developing pandemic.
Yes, and had actually very frequent contact up to 2020.